Roemheld syndrome, or gastrocardiac syndrome, is named after Dr. Ludwig Roemheld, who discovered and researched this phenomenon more than 100 years ago. Based on Roemheld's research in 1913, this syndrome arises due to the complex relationship between the gut and the nervous system, along with the nervous system's association with the heart. Despite its historical significance, this syndrome is not commonly recognized, although it is taught in medical schools in Germany. Roemheld syndrome can be understood in simple terms. When excessive gas builds up in your stomach after a large meal, it can press against the vagus nerve and the diaphragm, which in turn can put pressure on the heart. This elevated diaphragm positioning and medial displacement of the heart impairs the heart's ability to adequately fill with blood, thereby increasing the heart's workload to maintain homeostasis. As a result, patients experience functional cardiovascular symptoms, including arrhythmias that are not detectable on an electrocardiogram, EKG, tachycardia, or bradycardia. If you check the pulse of someone experiencing an episode with an irregular heartbeat, you may feel a pattern, perhaps 3 beats, followed by a pause of 2 seconds, then one more beat, another pause, then suddenly 5 beats, and so on. Individuals may also experience vertigo and dizziness, which can manifest as flickering lights or a general feeling of lightheadedness. They may feel a lump in the throat, similar to the feeling after swallowing too many pills at once. This sensation can sit under the sternum, resembling a lump or the sensation of food stuck in the esophagus. Ringing in the ears, tinnitus, and sleep disturbances can also occur, leading to awakenings in the night with unusual sensations or heart palpitations. Many people feel anxious when they experience heart symptoms. For instance, when they feel dizzy or notice an irregular or racing pulse, it can lead to panic. Often they rush to see a cardiac specialist, but the medical professionals may not fully understand their concerns. After conducting an EKG or other, sometimes invasive cardiac testing, which typically turns out normal, the doctors may attribute the symptoms to anxiety or nervousness. In some cases, patients are prescribed strong medications for their heart issues or anxiety, even if they might not truly need them. This lack of awareness is surprisingly common among healthcare providers. It is important to note that gastrocardiac syndrome can be triggered by a variety of factors beyond simple overeating. Research conducted in the late 1920s to 1940s showed that the vagus nerve is a vital link to the syndrome, since it is the link between the brain, heart, lungs, and GI tract. The vagus nerve also conveys sensory details regarding the state of the body's organs to the brain. The reflexive response of the nervous system, illustrated in accompanying diagrams, highlights the pathway along the vagus nerve from the stomach to the medulla oblongata and the thalamus, both of which have significant regulatory responsibilities in cardiovascular functioning. This condition is often misunderstood in clinical settings, particularly in critical care environments, where its symptoms may resemble those of a myocardial infarction. Consequently, it is crucial to consider how dietary combinations, particularly the interactions between carbohydrates, proteins, and fats, affect gastrointestinal gas production and subsequent cardiovascular outcomes. The recognition of associated symptoms, such as sinus tachycardia and dyspnea, highlights the need for a thorough understanding of this condition in both clinical and academic contexts. I have compiled a quick list of rescue supplements that provide instant relief from various symptoms, with many effects noticeable within a minute of consumption. Nemabase. This is a specific alkalizing mineral that effectively neutralizes acidity. It is particularly beneficial for managing conditions such as acid reflux offering rapid symptom alleviation. Terra Forte. Known for its ability to absorb gases, Terra Forte is even more effective when combined with Nimabase, which alkalizes gastric acids and stops fermentation. To use, dissolve a teaspoon in water for immediate relief. Frangula. Frangula decreases discomfort after meals by reducing gases. It is recommended to take 40 drops in water. Many individuals mistakenly associate symptoms with heart problems when they may actually stem from gastrointestinal issues. This misinterpretation can lead to unnecessary hospital visits, as people panic thinking they are experiencing a heart attack despite having a healthy heart. Avena sativa. This natural remedy calms the nervous system, particularly calming the vagus nerve. When combined with frangula and nemabese, it helps alleviate discomfort quickly. Marco Mag. This magnesium supplement serves as an effective muscle relaxer. For those prone to gastrointestinal symptoms, it is advisable to take 3 to 4 Nima-based capsules in the morning, along with 3 Marco Mag capsules for preventive care. Overall, these supplements provide prompt relief for individuals experiencing acute gastrointestinal distress, highlighting the importance of recognizing the connection between digestive and cardiac health. In conjunction with the suggested remedies, proper breathing is essential, as improper breathing patterns can contribute to these symptoms.
Now we will demonstrate different types of breathing. We have here a young athlete, Nicholas, who will volunteer and will demonstrate this. First, we show the first breathing, what most people do, and it's called the shoulder breathing. Take a deep breath, Nicholas. All right. Now, that's a breathing you do not want to do. It's also found that it can be stressful for the heart to breathe like this. Now, the next breathing, Nicholas, you turn to the side, and that's the stomach breathing. Put your arms a little bit back, yeah. And now take a deep breath. You see the stomach coming out there? Okay. But the lung is not in the stomach. And this came, do it one more time. You see that, right? Okay, very good. Thank you. And first of all, your lung is not in your shoulders. So to raise your shoulders is a bad habit. It came from the Prussian army when they had to stand very high with a high erected head, and that's how this came from, just for the looks, that you look very sharp as a soldier. Bad breathing. And then the stomach breathing, the Indians brought them from India. The gurus and teachers, spiritual teachers, they brought this over. And the thing was with that you don't have a lung in your stomach either. So stomach breathing is completely wrong. And why did they do this? Because by breathing like this, they're using the diaphragm to massage the intestines, because a lot of people there have digestive problems due to parasites and poor diets. And so therefore, the digestive problems they've been compensating with certain exercises, yogi exercises, to breathe with the stomach. It's also wrong. Now, the right breathing is just simply by expanding your rib cage, which nobody is aware of, and not most people don't breathe like this, including me. I learned this later. And you won't even see that you deep breathe. So take a deep breath now. You see on the sides, and breathe out again, and just do it a couple times, one more time. Yeah, you see the shoulders stay down, the stomach stays in. That is correct breathing. And when you ride a bicycle, for example, when you hold the handlebar with your hands, You will automatically breathe like this because you can't do stomach breathing. You cannot do shoulder breathing. You will breathe with your rib cage, and that's is the proper breathing. It will take training to learn this again because you may never even breathe like this. And then the other thing is what is also a danger where people get a lot of arrhythmia from and skipping heartbeats and depression and fainting, and this is by holding your breath. There's a tight moment where you're in the car and you hold your breath. That is very bad. That's the wrong breathing. So when you're in a tight situation, you breathe out. Breathe out. You can breathe out through your mouth. It's not so important if you breathe in through the nose or the mouth. That's not important. The most important part is to expand your rib cage left on right side. That's the proper breathing. And when you hold your breath, breathe out. Push it out. Any stressful situation while you sit in a car or on the phone and you hear some bad news or whatever it is. Or you just simply do some difficult work. Say like you're working on something specific, manual with your hands, and you hold your breath to not that it works out and that you don't make a mistake. People do this very often.
Thank you for listening, and please join us next time for the After Hours Forum presented by the Academy of Biological Medicine.